Hey everyone, in this video we will be discussing about the radicular cyst. In this diagram you can see that at the apex of the tooth there is an enlarged cyst which is a radicular cyst. The headings under which we are going to cover the radicular cyst are its pathogenesis, clinical features, radiographic features, histopathological features, and last one, the treatment. The radicular cyst can also come as a 5-mark short note or 15 marks long note in university exam. The radicular cyst is also known as periapical cyst, apical cyst, or the apical periodontal cyst. It is the most common type of the odontogenic cyst and it is a type of inflammatory cyst. The periapical cyst arises from the rest cells of the malaces. The question in the university exam can also come as a periapical cyst, so don't be confused. Or in viva, it can be asked the origin of the periapical cyst, that is from rest cells of the malaces. Now we will discuss about the pathogenesis, that is the epithelium of origin. Now in this diagram we can see that if a tooth has an enamel cavitation which is not treated or neglected, then it will further lead to the pulpal necrosis. The pulpal necrosis, if not treated, it can further lead to the formation of the periapical granuloma. Now, what is a periapical granuloma? It is a chronic inflammatory lesions located at the apex of the associated tooth. Now, we will discuss the pathogenesis step by step. The first step is initiation of epithelial proliferation and the cyst formation. Now, in this diagram, we can see that at the apex of the tooth there is epithelial proliferation. The proliferation of the rest cells of the malaces, which will further lead to the formation of the periapical cyst. Now it will further lead to the degeneration and death of the central cells within a proliferating mass of the epithelium. The cells which are located at the apex of the tooth, they will be degenerated and further lead to the death, which will be further causes the necrosis of the granulation tissue. And the necrosis of the granulation tissue will lead to the formation of the cyst. With the further time, the cyst will grow and enlarge, and the necrotic pulp will release the irritants and the bacterial antigens, which will further lead to the inflammation of the cystic capsule. Now, coming to the clinical features of the radicular cyst, first one is it will always occur in a non-vital tooth. The location of the tooth is the apex of the tooth and it also involves a carious tooth. Maxilla is involved more than the mandible. In the maxilla, the anterior teeth are mostly involved than the posterior teeth. In this given radiograph, you can see that the apex of the tooth is involved. If there is a small cyst, it may be symptomless most of the time. But if it is large in size, there will be swelling, mild sensitivity, mobility of the adjacent teeth. Now coming to the radiographic features, we will see a well circumscribed radiolucency associated with the apex of the tooth, and there is also loss of lamina dura in the area of the lesion. Now what is the lamina dura? It is a thin layer of the dense cortical bone that lines the tooth socket and the PDL periodontal ligament. Now its loss indicates a bone reaction to a chronic slow growing process. That is why loss of lamina dura is seen in a radicular cyst. Now it is a radiograph of the radicular cyst. The location is the apex of a non-vital tooth, commonly in the maxillary anteriors, and the size is usually less than 1.5 centimeter. Now the internal structure, there will be no calcification and is unilocular. If it is multilocular, it will show the honeycomb appearance. The histopathological features are it is a non-keratinized stratified squamous epithelium underlying sportive connective tissue. There will be seen mixed cell population. Lymphocytes are present, as we discussed in the pathogenesis, that there will be the release of the inflammatory exudates, that is our lymphocytes. Lymphocytes are the inflammatory cells. There will also be foamy macrophages, plasma cells. Plasma cells are also inflammatory cells. Rushton bodies, Russell bodies, cholesterol clefts, foreign body giant cells are its important characteristic features. The Rushton body and the Russell bodies are only seen in the radicular cyst. This is a histological diagram of the radicular cyst. Now coming to the last one, the treatment. We can go for extraction and the curettage of the apical zone. Now what is a curettage? Curettage is scraping and cleaning of the soft tissue. We can also go for the root canal treatment in associated with the episiotomy. The episiotomy is the removal of the tooth's root. So this is all about the radicular cyst. We have discussed about the pathogenesis, clinical features, radiographic features, histopathological features and treatment. Thank you so much for watching.